But in addition to these important issues, there's one topic we'd like to focus on today because of the growing threat that it poses to public health in the Commonwealth. And that is the rise in vaccine hesitancy and the resurgence of vaccine-preventable illness in the Commonwealth. So with that, I'd like to turn it over to Dr. Taylor.
Thank you, Lita, and good morning, Chair Decker, Chair Driscoll, members of the committee. My name is Hugh Taylor. I am president of the Mass Medical Society, and I'm a family physician. I've spent most of my career focusing on preventive care. So now, about vaccine policy. Decades of scientific research have proven that vaccines save lives, prevent infections, and avoid public health crises. And we are now deeply alarmed by the rising cases of vaccine-preventable diseases, like measles, which pose serious health risks. Massachusetts has long benefited from our society's commitment to vaccination, but recent declines in immunization rates are putting us at risk. There are now thousands of children attending schools across our state with vaccination rates well below the herd immunity threshold for all vaccine-preventable diseases. Vaccines are essential for protecting our patients and our communities, and that's why we continue to advocate for the removal of all non-medical exemptions, particularly amidst this measles outbreak, which is spreading nationwide. There is a strong correlation between between allowing non-medical exemptions and lower vaccine coverage, and that's become a growing public health threat. Physicians are seeing an increase in vaccine hesitancy among our patients, due to the spread of misinformation. We are committed to building public trust and addressing our patients' vaccine concerns with evidence-based science and data, but we also need strong state policy. The CDC now reports over 350 cases of measles nationwide. Massachusetts has not reported a case yet, but some of our New England neighbors have, and we are definitely at risk here. Measles is highly contagious, can result in serious health issues, and, as you know, even death, particularly for children and individuals with compromised immune systems. In some parts of the Commonwealth, over 20% of students are unvaccinated or undervaccinated. For measles, you need a 95% vaccination rate to maintain herd immunity. So the MMS thanks this committee for favorably releasing legislation in the previous two sessions that aims to close the non-medical exemption loophole in our school immunization law. We should not wait for the inevitable disease outbreak. We need strong policy that offers us the best possible protection against preventable disease, which will safeguard public health and protect our vulnerable populations. So thanks again for the opportunity to testify, and we look forward to working in partnership with this committee on this session addressing public health crisis, the immunization policy, and other critical issues. Thank you very much. Happy to take any questions.
Any questions from my colleagues? Yes, the one question I have for you, when you talk about, because we've also, this was reported in the Globe about the number of communities where kindergartners were over 22% unvaccinated, and that herd immunity is that you need at least 95%.
Correct.
I think the challenges with that data as well is that we actually don't have that data based on all of our communities, right? It's the communities that voluntarily provide that data.
That's correct. So we actually don't know.
So how worried are you when you think about, what it looks like potentially statewide?
So very worried. I mean, even certainly in my community, I've practiced on the North Shore for many years, seeing more vaccine hesitancy. There's no question that we have more kids who are unvaccinated there. Don't have the exact numbers, but my experience, my practice is that it's very concerning that we don't have the herd immunity that we need.
And my understanding from talking to some of your colleagues is that as adjacent states have actually eliminated what is non-medical exemptions, starting 5 or 6 years ago, we've seen some of those folks who would like a non-medical exemption move to Massachusetts, which we're trying to look at the correlation between when that started to the uptick in what seems like more communities that we know of having non-medical exemptions and less vaccines.
I have seen data, Chair Decker, that in states that have gotten rid of the non-medical exemptions, that their immunization rate has improved, and that's, I think, significant.
Well, thank you both for your work, and we will be hearing more from you throughout the session. Thank you.
Thanks so much.